By a show of hands, how many of you have a specific place at home where you store your medications, like a cabinet or a drawer? Well, at Los Angeles Christian Health Centers, or LACHC, half of the patients we serve live in homes like these and do not have the simple privilege of safely storing and accessing their medications on a daily basis. This issue greatly impacts the success of their health management, especially for patients who also have type 2 diabetes, which is highly reliant on daily medication adherence to prevent serious complications or death. Multiple 2019 reports estimate that 60,000 homeless people currently live in LA County. If we focus in on the city of LA, there are about 36,000 homeless patients. LACHC serves 5,000 of these patients annually, specifically in the area of Skid Row, and half of those patients also have type 2 diabetes. Please be warned that some of the next images may be difficult to view. Diabetic vision loss is the #1 cause of new blindness, which is extremely dangerous for our vulnerable patient population. Diabetes can also cause severe foot ulcers and wounds, which can then lead to increased rates of hospitalization and limb amputations, which are severe costs to both the patient and the healthcare system. Some of our patients have visited the hospital over 50 times due to their diabetes alone. We know that diabetes and homelessness individually are huge risks for severely poor health outcomes. But our homeless patients with diabetes are facing a seemingly impossible situation. Diabetic patients often must take their medications daily, usually using insulin for their care management. But the price of insulin has tripled in the last 15 years, making it extremely costly for patients to replace. And many of our patients living on the street can often lose or have their medications stolen. The insulin also requires the use of a needle, which is problematic for our patients living on the street because there is a stigma or assumption that those using needles are junkies or drug addicts, making our patients easy targets for theft or illegal drug exposure. Those living on the street are also subject to random street cleanups, where local law enforcement may come and strip all their belongings without warning. These compounding factors mean that many of our homeless diabetic patients will abandon their treatment plan and putting them at extremely high risk for exacerbating their diabetic complications.
Because of these inherent challenges, our patients have inquired about storing their medication at our clinic. To answer their expressed needs, we have designed a locker system for our homeless patients to store their diabetic medication at our facility where there's privacy and is easily accessible 7 days a week. Early next year, LACHC is opening a brand new clinic in Skid Row, which will house mailbox-sized lockers for patient medication storage. This initial 18-month trial period will focus on 38 homeless diabetic patients who require daily usage of long-acting insulin. In practice, the patient will arrive at the clinic, they will walk to their locker, they will take their medication and have a safe and secure place to administer it. They will then return their medication to their locker and be all set for the day. This quick and easy process will alleviate many of the issues our patients face when they are forced to carry their medications with them while living on the streets. So our vision is to improve patient medication adherence, reduce their diabetes complications, and ultimately to decrease the risk of hospitalization or even amputation. We will also provide a safe space for our patients to store and access their medication, empowering them to play active roles in their health management and to proactively treat their diabetes. We will also harvest our lessons learned so that we can expand this to LSC's other Skid Row location, replicate using other medications, and ultimately to share our findings with other FQHCs in LA County and across the nation who serve similar patient populations. Right now, we have expressed patient need. We have available clinic staff, and we have a new building where this trial pilot can take place. But we need the funds to properly install lockers, to recruit patients, and to hire security for weekend support, and also to evaluate this program's successes. Our team is asking for $80,000 to invest in an innovative way to provide our patients with vital services. With your partnership, we will empower our patients by providing them resources that will tangibly impact their daily lives and help improve their overall health outcomes.